Okay, we are all good to go. Okay, are you able to see my slide?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yeah, I'm all able to see my slide, right? Okay. Yeah. Last class we discussed something about indirect pulp capping, right? Where we said that whenever there is a caries process or a caries tooth, and if the caries is not, involving the pulp, rather it is close to the pulp, in order to avoid the pulpal exposure, we do a procedure which is called as indirect pulp capping. That is, the pulp is not exposed, so indirectly we are trying to restore the pulp. Now we move on to the next procedure, that is called as direct pulp capping. Okay, so direct pulp capping is, what is it? It is a procedure in which the small exposure of the pulp encountered during cavity preparation or following traumatic injury or due to dental caries with the sound surrounding dentine is dressed with an appropriate biocompatible material to be in contact with the exposed pulp tissue prior to placing a restoration. And this is called as direct pulp capping. So whenever you are doing a cavity, right, you are doing a class, most often than not, this mechanical exposure during cavity preparation happens whenever you are doing a proximal restoration, especially on the mesial proximal side, because the mesial pulp horns are placed very, very high. So what happens? That is why most of the times, if you do not gauge, yeah, the depth of the cavity and you keep on doing the cavity preparation, you might